Hello, welcome to Fibromyalgia Talks. I am your host, Nisi Edwards, and on today's show we have Dr. Randall Davis. Fibromyalgia Talks is all about providing you education on fibromyalgia, the consequences of having fibromyalgia, and what you need to know to live a healthy life. So, Dr. Randall Davis is with the Center for Holistic Medicine, and today's show is going to be about understanding fibromyalgia. So, understanding fibromyalgia is a holistic approach to chronic pain and fatigue. It is estimated that fibromyalgia affects at least 6 million Americans, at least 4 million of which are women. And the condition may be seen at any age, although it occurs most frequently during midlife. Fibromyalgia is a complicated condition. Many physicians who are not familiar with this disorder feel there are no clear-cut answers. However, people need effective relief, support, and guidance. Now, Dr. Davis, why do you feel that many physicians feel there are no clear-cut answers for fibromyalgia?
Well, it's kind of a mysterious condition. You know, when you say fibromyalgia, it's involving muscle pain and fibrous muscles and joint pain, things like that. There could be so many different causes for the pain and for the problems that people suffer from. It's tough for physicians to figure it out. The causations, there could be many different causations, and that could give us many different manifestations and different types of symptoms, as we'll see here in the presentation. So it's tricky. It could be infections causing it, it could be traumas causing it, it could be emotional issues combined with other life events. There could be autoimmune disorders, there could be genetic issues with people. So we see a wide variety of things that can cause these types of symptoms. And sometimes doctors just don't know, and they'll just say you got fibromyalgia, when it could be somebody who had a traumatic car accident and they have all the symptoms of fibromyalgia, but really they have chronic myofascial pain syndrome, or they have bones out of alignment that puts pressure on a nerve, and that causes muscles to go into spasm and have pain and things like that. So it's sometimes hard for the doctor to figure out why they have this condition, and sometimes you just kind of get lumped into this category where they call it fibromyalgia.
Okay. Now, I know as a fibromyalgia sufferer myself, one thing that I've learned about fibromyalgia is that it's also known as the invisible disease. And it's known as the invisible disease based upon my research because, for example, when you present to the doctor, let's say for rheumatoid arthritis, it's invisible because fibromyalgia is not something that shows on any labs. It doesn't show on x-rays.
Correct.
And they consider it to be more subjective than objective.
Yes.
Okay, thank you. So therefore, the purpose of tonight's talk, we're going to talk about the following. We want to provide you with some true facts about fibromyalgia. We want to help you make an informed decision about the various natural ways to help alleviate fibromyalgia or fibromyalgia-like discomfort. And here is how the word fibromyalgia breaks down. Fibro means from fibro or fibrous tissues, which are the soft tissues of the body under the skin, especially around the joints, including tendons. My from myo meaning muscle. Alg from algos means pain, and aya meaning state of or condition. So fibromyalgia simply means a condition which is characterized by pain in the muscle and soft tissue fibers of the body. It is the third most prevalent rheumatologic disorder after osteoarthritis and rheumatoid arthritis, and it represents 5% of family practice office visits and 20% of rheumatism visits. Approximately 90% of fibromyalgia patients are women. Wow.
Yeah.
That's a lot. Between the ages of 40 and 60 years of age. So the average age, they estimate, is 49 years of age. In other 10 to 20% of cases that affect males,
Basically, they have the same symptoms that the females present with. So it is true. We see a lot more in our practice as well. A lot more women have those type of symptoms, the fibromyalgia, classic types of symptoms, pain and discomfort, sleep issues, emotional issues. So there seems to be multiple factors that get included in this diagnosis.
Okay, and so men suffer the same
Yes.
identical symptoms as women do.
Yeah.
But basically, it's just more incidence of women.
Yes.
Okay.
We don't know why. Maybe it just physiologically affects women. Maybe guys don't talk about it. They might be a little more macho, or you know, my practice tends to be a little slanted towards women. But basically the symptoms are going to be similar to what you'll see in women.
Okay. Now, I know that people with fibromyalgia, they will experience widespread pain of at least 3 months duration.
Right.
And some people are often unable to continue in certain kinds of work due to this widespread pain. Now, I find this very interesting, and I can relate to it at the same time, Dr. Davis, because in 2013, I had major surgery, and 3 days before my surgical procedure, I was at a red light and I was rear-ended.
Yep.
So then 3 days later, of course, I have surgery, and I had such intense pain.
Right.
And I since have learned now that having major surgeries, which they say is due to trauma as well as stress, I believe that created the onset of my fibromyalgia, because in addition to that, I also was under a lot of stress at work.
Right.
And when I look back now at my life, and after all this research, now that I've been diagnosed with fibromyalgia as well as rheumatoid arthritis, I now better understand what's happening to my body. And it's amazing to me to find out that you experience widespread pain at least 3 months duration, and that's usually for many people the onset of their fibromyalgia, because it's usually some type of trauma.
Yeah, that's how they're diagnosing
stress.
it. Yeah.
Okay.
And it could simply be scar tissue forming from the sequelae of having an accident. I've studied trauma to the spine very extensively, and I can tell you that within several days to several weeks of that trauma, the body's going to start to form scar tissue, and the body lays down different types of collagen to repair those fibers. So you combine this process happening where it takes many months of the body to repair and remodel the tissues, along with the stress that you talk about, whether it's an emotional stress from work, from relationships, from kids, life, whatever. You could have physical stress, like the stress on the body.
Yes.
You could have a chemical stress. Maybe your body's toxic. Maybe you smoke, or maybe you're in a toxic environment, or maybe there's mold, or whatever. You're inhaling bad air. That's a stress on the adrenal system, and when the adrenals are under a lot of stress, then their immune system will get suppressed. Your body starts secreting different hormones and enzymes, and when you talk about a rheumatoid arthritis, now the body's breaking down bones, breaking down muscles, you're getting joint deformities, and the body's turning those joints and those muscles into sugar. They call that gluconeogenesis.
Okay.
And that's an abnormal process because the adrenal hormones, and then we look at chemistries in the brain, gets a little in-depth, but we talk about the hypothalamus and the pituitary gland. Those are overseeing hormone secretions, and when the adrenal hormones are way out of balance, the body goes into what we call catabolic state, meaning you're breaking down tissues in the body.
Okay.
So that affects the joints, the muscles, the tendons, the ligaments, and there are ways to correct that. In fact, we are now aware of a very significant treatment that balances the hormones to reverse the effects of osteoarthritis, rheumatoid arthritis specifically, and I think it would be very beneficial for people who are diagnosed with fibromyalgia, whatever the cause.
Okay. It basically sounds like the body is, in essence, attacking itself from a foreign invader.
Yeah, in a certain sense, the body is not sure what to do, so it's attacking itself. And again, it's from the stress, and the body's in a survival, flight or fight mode, trying to stay alive, so the body will seek a balance any way it can. And if it has to steal nutrition from one organ to help another organ, it will do that.
Okay, thank you. Other symptoms that people need to be aware of also include chronic fatigue, that physical or mental fatigue. As a fibromyalgia, suffer, I can definitely relate to having chronic fatigue. I mean,
Correct.
because you do not get a restful night's sleep.
Right. And
You
that's
know.
your adrenal glands again.
Yes.
If you're waking up at 2 in the morning, 3 in the morning, 4 in the morning, you're waking up several times a night, your adrenal glands are just screaming, and you're secreting cortisol as either a mechanism. Maybe you're posturing against an infection, maybe your blood sugar is lowering in the middle of the night for whatever reason, but it's usually a blast of cortisol from a malfunctioning adrenal gland that will cause these bursts of cortisol secretions in the middle of the night, and then your body wakes up.
Okay, because I know that sometimes I may not be able to go to sleep till 4 o'clock in the morning. I
Right.
feel tired,
Yep.
exhausted, and
Yep.
drained,
Yep.
but I just cannot sleep.
Yeah. And you wake up feeling like you never even got a good night's sleep.
Yes,
Yeah.
you wake up feeling like you're in a fog, you know.
Correct.
Also, I do tire easily. I know that that's one of the symptoms.
Yep. Yep.
Also, morning stiffness, and that morning stiffness is very debilitating because you wake
Yes.
up and having pain from head to toe.
Yes, yes. And again, your body relies on the adrenal glands to secrete a hormone, a cortisone hormone, as an anti-inflammatory and as a pain reliever. And the body will take progesterone and it converts it into cortisol. So now we have women coming in with female problems and estrogen dominance problems and cysts and tumors and fibroids and endometriosis and all these things because the adrenals are so tired they're taking the progesterone away from the female organs and trying to convert it into cortisol. So
Okay.
again, it's a survival mode and the body's going to have to prioritize what it wants to do.
Okay, thank you. Also, another symptom is urinary urgency and anxiety or stress. And I feel that today many women are under a lot of stress. Women with children, even if you don't have children, just a lot of stress because it could be in your relationships, in your home environment,
Yes.
on the job, because now there's no such thing, I feel, no longer as a 40-hour work week.
Right.
As 40-hour plus or
Yeah.
50-hour,
Yep.
60-hour plus
Yep. And you're
for
on a
many
salary.
women. Yes.
So you're not making extra money, but
True.
you're working harder.
And
Yeah.
not to mention the stress from the lengthy commutes that many women
Right.
have to face, child care issues,
Right.
a lot of stress.
And I might add another stress on the body that no one really thinks about in this day and age, other than maybe guys like me, is the frequencies that we're exposed to from cell phones and
Yes.
wireless and you know, your Wi-Fi at home, and every building you walk into has Wi-Fi, and every hotel has Wi-Fi, and the whole world is being electrified, and we've never been subjected to electromagnetic frequencies ever in the history of the planet like we are now. So it changes the way your body functions. Some people are more sensitive to these frequencies than others.
You know,
So-
you raise a very interesting point because I remember reading an article that states for fibromyalgia sufferers at nighttime when you get in bed, don't have your cell phones on,
Correct.
don't have your tablets
Right,
on
right.
because those frequencies can
Right.
interfere with
Oh,
your
yeah.
sleep rhythm.
Absolutely. And those cell phones, they emit radiation. You know, these guys on the internet, they have a little meter that detects radiation. They hold it up to the meter, the phone, it goes woo, it makes a noise, and it's like, wow, this thing. So you wouldn't want to have it next to your head. And the younger you are, the more susceptible you are to these radiation wavelengths coming from a cell phone. So when I see little kids holding the phone up to their ear talking, that makes me nervous. Or also I see kids playing with their iPhones or their iPads and they're doing video games. They're holding the thing right on their lap and they're radiating their genital area. So that freaks me out a
Not
little too
good.
because that could affect fertility. Who knows what could happen. But
That's true.
that might be something just to be concerned about. But the frequencies that people are exposed to, it's unlike we've ever had. So that can cause physical changes and damage to the body as well.
So is it better with those frequencies than to then wear like headphones? So for my iPad, I have, and my cell phone I'll use.
Yes, you want to have the phone out here, and then you have the, you know, you can talk into the little
Yes.
microphone. I don't know if I like the little Bluetooth things that are sitting in your head, your ear, because I think those radiate you too. So,
Okay, that's
you know,
good to know.
I think there's a lot of studies that need to be done. But you're seeing cases. There was a case in England where someone already was. She had a brain tumor. This person, a guy, I don't know if it was a guy or a woman, they were on their cell phone literally 8 to 10 hours a day for business, talking. And after a number of years of this, they developed a brain tumor on the same side of the head that they talk on.
Oh, wow.
And they took him to court in England, and they won the case. So there is a court now that has sided with the patient and said, yes, we believe it's possible cell phones cause tumors and radiation damage to the brain. So food for thought.
Okay, thank you. Now, I know that irritable bowel syndrome, or IBS, is also a side effect.
Yes.
Sleep disturbances, as we mentioned, tingling and numbness, I can definitely relate to that.
Yep.
Excessive menstrual bleeding, and gastrointestinal symptoms.
Yes.
Okay, and approximately 75% of fibromyalgia sufferers experience sleep disturbance, which can range from insomnia to wakefulness to non-restorative sleep, and the discomfort will be aggravated by extremes in temperature as well as humidity. You know, what that brings to my mind is also known as fibro fog. You know, because with fibro fog, many sufferers, we experience problems not only with sleep and insomnia, but also it affects your memory.
Yep, your cognitive
Yes.
abilities, absolutely.
Also, people with fibromyalgia will also have tender points in at least 11 of 18 locations.
That's how they diagnose it. There could be 40 locations where a patient could have trigger points. But the medical community has decided that if we have 11 of these 18 points that are spread out throughout the body, that would qualify you as a diagnosis for fibromyalgia, at least one of the criteria that they're looking for.
Okay.
Again, those could be caused by other things, so you know, that's where it gets difficult to diagnose, and you really have to look at the causation and the function of the body, what's happening leading up to the point where the body is now expressing all these trigger points and these muscle spasms.
Okay, so if you do not have 11 of these 18 tender points, you might still have fibromyalgia.
Correct.
But it's only by being examined by a trained physician can that diagnosis be made properly.
Yes.
And I also have since learned that many women have suffered from fibromyalgia for many, many years.
Yes.
It's just that they've just never been diagnosed with it.
Yeah.
And oftentimes, you know, we're told it's all in your head, which is not true.
Yeah.
Because this pain is real and it's very debilitating.
Yes. And again, we see many people who have been diagnosed with fibro, they have emotional issues. And it's hard to say, was the emotional issue senior to the fibro, or was that a result of the fibromyalgia type of symptoms? It's probably a little of both.
Okay. I know that a lot of women, as well as men, oftentimes have difficulty finding a trained physician that understands fibromyalgia.
Right.
And as a chiropractor, because he or she may work with their hands, they can also recognize and detect these tender points in the person's body. So there are two possible approaches to treating fibromyalgia. One would be drug-free approaches, which would be natural therapies that support the body's innate ability to heal itself.
Right.
Also, drugs such as Elavil, Indep, Flexeril, Prozac, Paxil, Zoloft, Advil, Motrin, Aleve, etc., including Elavil, Indep, and Flexeril. Those are widely used at night to modulate your sleep disturbances. And however, it appears that in long-term therapy, the benefits are oftentimes lost and the side effects are often daunting. Now, there are also some non-steroidal anti-inflammatory drugs.
Correct.
Okay.
Like aspirins and ibuprofens, things like that. They call them the NSAIDs, or the non-steroidal anti-inflammatories.
Okay.
So those are used widely. The problem is long-term use. The studies are not great for what it's going to do to your kidneys and your liver. So we have to be careful how much we use of that and how long we use it, which is why there's an alternative approach, because a lot of people in this day and age don't want to rely on the drugs. They don't like the side effects. It's uncomfortable for them. And we're seeing that there's so many advances in the alternative world at this time that we can certainly help a lot of these people, and they shouldn't need to be on all these drugs.
So what are some ways that in your practice you work for fibromyalgia patients? Now, I've known you for a number of years. I remember when I used to work at TAP Pharmaceuticals.
Right.
And in about 2000 is when I started my career at TAP Pharmaceuticals, and we were having a wellness fair.
Yes, I was at that wellness fair. Man, that was probably almost 10 years ago now. So, and that was nice. They let a chiropractor in the pharmaceutical company, so I thought that was pretty progressive of them at the time, actually. And I screened a number of people that day, and we were looking for trigger points and muscle spasms, and just about everybody I screened had a number of issues in their neck and back, and there was a lot of stress going on at that place.
Yes, I was getting ready to mention that as well. And Dr. Davis, one thing that I liked about you, and I still do, is the fact that you care about people. You care
Yes.
about your patients.
Yes,
now,
I do.
when I first met you at our wellness fair,
Right.
I had my gardening booth, and I saw that you had your booth all set
Right,
up, and
right.
that you were given adjustments on site and talking to a lot of the employees, and that's when I walked
Yes.
up to you and introduced
Yes.
myself.
Yeah.
And you were so very, very friendly. You were very cordial, and what impressed me and what stood out about you was it was just, I just felt like you were someone that I have known for a long time because you made me feel very comfortable.
thank you.
You were easy to talk to.
Right.
And after that, I did see you for other ailments that was
Yes.
not related to fibro,
Right.
and you were a big help to me.
Thank you.
So
Good.
thank you so much for your time. And what I wanted to ask you is, how do you work with fibromyalgia patients in your practice? Because oftentimes, women especially,
Yeah.
have a very difficult time finding doctors who
Right.
have an interest in
Yes,
treating
yeah.
fibromyalgia.
Right. There's a lot that don't want to, because they just run out of answers. There's a lot of pain involved. There's a lot of suffering. You have to have compassion for these people because it's a big effect on their life. And some doctors just don't, maybe just they're frustrated, they don't know how to treat them, or they don't feel they're getting good results. What I do is, after we take a thorough history and get an understanding of where you're at in life, I'll do a complete physical chiropractic exam. So in that exam, we're looking for things like range of motion. Can you move your head or your back without any kind of pain? There's specific ranges. You should be able to turn your head all the way to the side without any discomfort. Things like that. We do orthopedic testing. We do palpation, which means we're going to feel the muscles. We're going to look for those 18 points.
Okay.
I'll look at all the spinal muscles in the neck and the spine and in the legs and so forth. We do reflex testing. I'll do neurologic testing with a pinwheel if we need to. We do muscle testing for motor strength. And then I do energy testing and energy work on people as well. That's where we're looking for nutritional deficiencies. We're looking for other causations. We're looking for fixations in the spine, where maybe if you have two bones in relation to each other, one's not moving properly or one is sitting off kilter, let's say. And if it's just sitting like that, it's going to put increased stress on a nerve. When you have increased stress on a nerve going into the brain's going to send that message back out to the spine, to the muscles. As a reflex or as a reaction, you're going to get a spasm, you're going to get a trigger point, you're going to get pain. And when you have pain, that causes spasm. And when you have spasm, that causes pain. And then you've got this little neurologic loop of pain and suffering. So the physical treatments that we do are designed to get in there and break up that loop. So it's a very thorough exam. I believe nutrition is crucial for healing bodies, even with physical conditions. A lot of people come in with toxicity. We'll look at the liver and the kidneys and the bladder. We'll look at the heart and the thyroid. So my goal is to put it all together from a chemical and a physical point of view. And maybe we can do some work with the emotions, but mainly I work on the chemistry of the body and the physical body. So we try and go for an overall support. It's hard for a body, if you're lacking the proper nutrients, to heal itself. So, and if you've got a digestive system that's not working properly, that's going to be trouble. So we look at that very carefully. We can look at foods that you take in. We can do blood tests and saliva tests and urine tests and really look at the biochemistry of the body and put it together functionally, how it's going to affect the structure and the pain. Like I said, if you've got tired adrenal glands, it's going to be really hard to get out of pain. So if I just adjust you and do muscle work and all this great stuff, but your adrenal glands are shot, you're not going to get as good of a result as if I can prop up those adrenals, get your heart strong, get your thyroid secreting the proper hormones. Your body's going to function much better. So I really like to look at a global perspective of the body. As far as the physical treatments, when we talk about a chiropractic adjustment, we can do a manual adjustment, where that's a traditional that most people think of when you think of a chiropractic adjustment. popping the neck or adjusting the neck or the back or the lower back. We also have handheld devices that are very simple and gentle. A little spring-loaded device like this right here.
Okay.
It's called the activator. And this little guy, you can just put it right on the spine and click it. It's great for newborns, for 90-year-old women who have osteoporosis. Very gentle, very safe. Some people won't go to the chiropractor. They think we're going to twist their head off and, you know, pop them like a pretzel or something. So, in fact, we have an ambulance in the back just in case that happens. We just ship them right down to the hospital. No, I'm just teasing you. But it's very safe, very gentle, and my approach is I like to customize the treatment for the patient. Safety first, of course. On the first day of chiropractic school, they teach you primo, no nocere, first do no harm.
Okay.
So that's our goal, is to make sure it's safe and gentle and we don't hurt you. But there's a lot of techniques that we can do to relieve the pain. I do a lot of muscle work. I think that's important. I've got a light beam generator, and we can put a slide up, and we'll show you what that looks like. But that's a machine that gently helps the lymphatics in the body to drain.
Okay.
We've got muscle stimulators. I think we use that on you. I can do acupuncture, which is really nice for pain and inflammation, and that helps to get the energy moving and the stagnation of blood flow. So there's a lot of things we can do physically to the body, but it's also important to work on the chemistry of the body too. If we put those together, that's why we get such good results.
All right. I definitely want to explore acupuncture for the fibromyalgia as an alternative therapy, because I've heard that a lot of people have benefited from acupuncture.
Absolutely. It's incredible for pain and chronic pain. The acupuncture needle, when you put it in the skin, it actually vibrates at a specific frequency, 90 millivolts, which that's a healing frequency. That helps also to desensitize the pain receptors. So acupuncture is very, very beneficial for chronic pain sufferers.
I used acupuncture a number of years ago, and I used to suffer from migraine headaches.
Yes.
And that was the very first time I've ever tried it, and I did get some wonderful results with it.
Yeah, we should definitely try it for your fibro now.
Okay. Now, with the causes of fibromyalgia, and we talked about the symptoms with the trauma and the stress, as well as the irritated nerves, lack of exercise. So exercise is important.
Exercise is important, although you don't want to exercise because you're
painful.
in pain.
Yes.
You almost have to fight through it or do whatever you can to get some kind of motion into the system. Again, chiropractic care helps to restore motion, which the spine and the body thrives on motion. Even if it's swimming, it might just be walking. Some kind of movement seems to help people feel better.
Okay.
Yeah.
I've tried movement, and I can only speak for myself, but you're right, exercise is important, but I think for a lot of women, though, with fibromyalgia, sometimes your balance even feels off, you know.
Yep, sure.
So there's always, sometimes you just don't feel necessarily comfortable or stable on your feet.
So whatever's safe. I mean, we got to do a safe exercise. Maybe it's riding a stationary bike or just walking on a treadmill where you can hold on to the bars or something. But we got to get you moving. There's no doubt that will help. And it might hurt at first, but as people move, you almost break through the pain, and your body will start making endorphins and its own painkillers, and you may very well have less pain by the end of that workout. Okay.
Now, when it comes down to toxicity, can that also be caused by toxicity in your food? So, for example, if you're eating a lot of foods that have GMOs, genetically modified organisms in them. When I shop, I always look for non-GMO products, organic,
idea.
You know, grass-fed.
Yes. Well, here's the issue with GMOs that most people don't know, and we could do a whole show on Monsanto and GMOs and all that stuff. But the recent research has shown that in the GMOs, there's actually viral fragments, and they've totally screwed up when they started doing this whole genetic modification process. The researchers either discarded the fact that the viruses were in there. I think they probably knew they were in there but didn't think it was going to be an issue. Maybe they thought they were dormant and dead and wouldn't be a problem. But they are loaded with viral fragments, and I believe these viral fragments can reactivate in the body, and we're seeing that. And I think that's part of the increase in autoimmune diseases.
Yes,
I think you're going to see a huge in the next 10, 20 years with all this modified corn, all the canola oils modified, so I wouldn't touch canola oil. corn oil is bad. It's got to be organic, otherwise it could be GMO. The wheat is horrible.
Yes.
So people eat wheat, and everybody's got wheat allergies now, and everyone's trying to go gluten-free, which is a great idea. So that is scary, because you could all of a sudden have a viral fragment activate in your body, and all of a sudden your body has an autoimmune reaction. It's attacking itself, probably because there's a virus or some kind of invader. And people are going to be ingesting more and more of these over the next 10, 20 years. So it's going to be scary out there.
Yes.
So we're going to need more strategies to fight viruses and infections and things like that.
And with GMOs, a lot of testing was not done on the human population, so
Right.
it's still yet to be determined
Yep.
the effects that it's
Yep.
going to have on the body.
Yep.
And that's why I think it's important that for our families, when we go shopping for groceries and the food that
Yes,
we
absolutely.
prepare,
Yep.
that we know what's
Yep.
in it.
Well, I'm in a buyer's club. We get our milk. I drink raw milk, and that could be another episode or
Okay.
whatever, but raw, unpasteurized milk is the only type of milk I would drink. I wouldn't drink pasteurized milk. So this comes right from a farm 3 hours away, and this in the buyer's club, they go down to the farm every week, and they bring back organic meat and chicken and fresh eggs and honey and all grass-fed and
Healthy.
organic, yeah, uncured, and much healthier way to go. So that's we've got to just go in that direction for our safety, for our health, for
So
sure.
this Buyers Club, is it similar to like the CSA, the Community Supported Agriculture? Or one of the co-ops?
Yeah, it's kind of like a co-op. So for a very nominal fee, you join the club, and that makes it legal to be able to purchase the milk right from the farmer, and it's the healthiest way to go. The raw milk has antibiotics in it. It's got antipathogens in it. It's got aminos. It's got fatty acids. It's got probiotics. It's got lactoferrin to help your body keep iron, lactoperoxidase to kill bugs and things. But once you pasteurize that, it's inactive. You might as well not drink it, in my opinion.
Okay.
So yes, food toxicity is a huge. When you think about a plant that's, you can't even kill it now with Roundup because it's resistant to it now. So now they need stronger pesticides. They want to legalize DDT again to use on our crops,
I read that
right?
the other day. Yes.
So that's scary. So do you want to eat a food that is so resistant to Roundup? I mean, then you're going to eat that. What's that going to do to your body? So
True.
it's very scary. Very scary.
Very scary.
Yeah.
I would agree with that. So a multifaceted healthcare and treatment plan, such as exercise therapy, stress reduction, nutrition, and chiropractic care,
Yes.
has shown the most promise for fibromyalgia sufferers. Okay. Now, let's discuss the natural approaches which have been proven to be effective in handling the problem of fibromyalgia.
Yes.
The first one was, I know we discussed, was exercise. So research has indicated that more than 80% of patients with fibromyalgia, they're not physically fit.
Mm-hmm.
And it's understandable that fibromyalgia patients do not want to exercise because of fatigue and pain.
Yep.
But we still need to push through the pain.
If you do, you're going to have a better prognosis, definitely.
Okay. Now, what about cardiovascular exercises?
Yeah, swimming, again, very good. Walking, whatever you can handle to get the heart moving a little bit. It's going to just pump the blood more and help flush the system, oxygenate the tissues. So you can't say enough benefits. It doesn't have to be rigorous exercise. That's the thing people don't realize. From a heart perspective, all you have to do is walk 15, 20 minutes a few times a week. You'll greatly reduce your chances from here to here of getting a heart attack. And then the ones who are really rigorously exercising, maybe they get a little more benefit, but not that much. So
That's
you
a
don't
good
have
point.
to be training for a marathon to benefit from the exercise.
A recent study followed 40,000 postmenopausal women for 7 years, and it showed that those who regularly engaged in moderate activities, they had a 41% longer lifespan than those who did not
Yep.
exercise.
Yep.
Wow. And then a 7-year study by the University of Minnesota
Yes.
involving 12,000 men found that those who walked or did similar exercise for an average of just 20 minutes a day,
Yep.
wow, were 37% less likely to die of coronary disease than those who exercised less than that.
There you go.
So stress reduction. Many fibromyalgia patients remember a specific triggering event associated with the abrupt onset of the symptoms of fibromyalgia.
Yeah.
I can definitely relate to that.
Right.
Stress It can be an injury, it can be marital difficulties, job dissatisfaction, as well as stress.
Yeah.
It's just amazing to me about how much stress can affect the human body.
Yes.
And the problems stress can cause.
Yep. We could do a whole show on stress. That's been very well studied and researched. And again, your adrenal glands, those are your stress glands. So when those are taxed, then your chemistry changes.
Well, Dr. Davis, all the information you've shared today has been awesome, and this is going to be a great benefit to fibromyalgia sufferers such as myself and many others, especially those watching the show today.
Well,
and I just can't thank you enough for all the information that you shared with us.
Well, I'm happy to be here, and hopefully we can help anyone who's out there suffering. It would be my pleasure and honor to be able to do what I can to help people get well. That's why I'm here. I've studied these conditions for just about 30 years now and treated thousands and thousands of patients, and I've seen these conditions, how it affects people. And the rewarding part for me is taking someone who's a 9 out of 10 on a pain scale and they're in bed and they can't work, and getting them down to a 1 or 2 or 3 and seeing them get back into their life, into their routine, into their job. That's why I'm here. I'm here to help people.
Thank you. I appreciate your time today. And for more information, Dr. Davis can be reached at the Center for Holistic Medicine.
Correct.
And Dr. Davis, I thank you for your time today. It's been a pleasure
having you, Nisi. Nice to see you again.
Thank you.
And look forward to working with you further, and happy to discuss more in-depth issues relating to health and nutrition and detoxification in the future with you.
Thank you. And this, again, is Fibromyalgia Talks, and I am your host, Nisi Edwards. I can be reached for additional information at nisiedwards@gmail.com. We thank you for your time today.
So I'd like to offer everyone who's watching today a special gift, and that's a chance to come and actually see me in person and meet with me for a 30-minute consultation. It'll also include a screening evaluation to see if perhaps you're a good candidate to benefit from the care that I might offer you. So one of the things that could be a roadblock to coming in might be the fact that you're not sure how much it might cost, you're not sure if I could help you. So as a way to remove any kind of roadblocks to coming and see me, because there is a chance I could actually help you if we find that you have something going on that relates to what I do. To remove any roadblocks, I'd like to offer you a chance to come in for a very valuable offer. It's going to cost you nothing, free of charge, a half hour of my time. We can talk and consult and discuss your condition in depth, and I'll have an idea at the end of that discussion if I think I can help you. And if so, then I would invite you back for a complete exam, and we can discuss insurance and fees and all that and see if it's something that you might actually benefit from. If you're interested, please call my office at 847-236-1701 and hit extension 0, and you just tell them you'd like to make an appointment for to see Dr. Davis, and you saw him on the TV show, and this is a special relating to that show for a free half-hour consultation. Hopefully we will see you there soon.